So the next spelling word that we're going to have is going to be Avpu. We went over this with the sample. I just realized that's super light. We went over this in the, sorry, not the sample, in the 5-3 ABC Go. We're going to go over it again here just because Avpu could be kind of confusing. This is going to be your level of alertness. Again, you can only be one of these things. So you start with alert. This is walking in, they're talking to you, they're able to answer your questions, they're telling you what's going on, they are telling you their name and why they called or why you're there, those kinds of things. They are normal like you and I, alert. Maybe not normal, but they're up, they're talking to you, they can look at you, all of those things. If you walk in and they do not look alert, they don't look at you, they don't follow, they don't answer questions, the next thing you're going to do is go to verbal. This is talking at a level that they can hear you, and that means assessing your patient. If it's an elderly patient, speak so Mima and Papa can hear you. If it is a younger person, still speak loud enough so that Mima and Papa could hear you if it was a Mima and Papa patient. Give them the opportunity to listen to your voice and hear you. Because next is painful, and if you go pinching somebody without making sure that they're alert to verbal, it's not going to be a pretty sight. So, verbal, and this means, again, you walk in, now sometimes they might come to verbally and then be alert. I count that as alert, but if they're verbal and then they kind of go back down and then you have to keep using your voice to get them to come around, that is alert to verbal. Painful stimuli is going to be the next one. So if they're alert, then you stop. You don't come down to the VPU. You stop at alert. That is their Avpu score is A. If they are not alert and you cannot get them to talk to you, then you move down to V. So then, okay, so now we're alert to verbal. All right, so that's where we stop there. Okay, but they're not responding to you verbally. Then we move down to P, which is painful stimuli. And your book says to pinch the earlobes or to pinch the skin above the clavicle. And that is going to be your painful stimuli. If they respond to that, then you stop here at P. They are alert to painful stimuli. And then if they do not respond to any of these things, they are unresponsive, which is going to be the U in your Avpu. And that is what you have right there. This is going to be used on every single patient that you have. And it is just a simple, what is their alert status? If they are up, talking, walking, or looking at you, they are alert. And then if not, you just move down the list until you figure out which of these that they are.